recently been talking to some social workers within our hospital and health services, talking about how they're preparing for the opening of the borders here in South Australia, and what that means for our social work workforce. They're doubling the intake of social workers to prepare for what will happen within our hospitals and hospital services. We've been rather protected here in South Australia. There's certainly been an increase in demand on our social work services as a result of COVID-19, where our social work workforce has been called upon to respond to the increasing mental health concerns for a vast number of population, certainly in relation to many of our international students. The environment within which social workers are working at the moment is incredibly complex, and COVID-19 has just added another layer to an already complex environment. Our social workers are really stepping up to the mantle in responding to COVID-19, taking on additional leadership and responsibilities, and working at the coalface as well as working on structural change. COVID-19 has actually impacted the social work workforce in terms of making people reconsider whether social work's the right career direction for them, and whether it's actually time for them to prioritise their family and step away from delivering social work services within the hospital sector because of the increasing demands that are placed on them in terms of delivery of those services within the hospital systems. As a result of this, there's been an increased demand on social work education sector. We need to produce more graduates to ensure that we have a continued workforce within the health sector to be able to maintain the delivery of services once the borders open up. Just in terms of the demands on social work and health services will be at its peak 100 days after the borders open. And so the government is planning the workforce around the concerns about this peak demand and how they're able to continue to deliver high quality services to the South Australian community. Hospital social workers are incredibly stretched in terms of their ability to respond to the demands in relation to a whole variety of concerns around increased mental health, increased alcohol and other drug use, a whole number of social problems has increased the demands on social work services within the health services. I think here in social work we are providing enough supply for the demand that we have. We've got 2 social work programs in South Australia, so I actually think we do have enough supply of social work practitioners.